Today, we are here with Dr. Pacheco from 65 Forward, and this is a very unique program that is only available here at Geisinger. So when you are looking at 65 Forward, my understanding is that this is really the primary care heaven, right? And so as a primary care physician, tell me a little bit about how you got drawn to primary care. What is it that kind of gets you up, gets going, gets you excited about the primary care setting?
Thank you so much for having me today. What I love about being in primary care at the moment is that we are just on the cusp of so many wonderful things. You know, primary care is the foundation of medicine, right?
100%.
So it builds from us up, right? And so being now in senior focused primary care, it has allowed me to step into a realm where we know the majority of our patients will be. We know we're headed into a silver tsunami where we have tons more people over the age of 65. What we're doing in 65 Forward is providing a comprehensive personalized approach to primary care for seniors specifically. What we've been able to do is take great care of chronic diseases, but in 65 Forward, we get to be more preventative and more proactive about things like medications and other areas of support that you would need, from social determinants of health or just someone to talk to. We know that social isolation is a big thing as we get older. Many things change in terms of people's lives, loved ones around them. And so we're trying to bend some of that in 65 Forward today by having an approach to not only comprehensive clinical care, but also a holistic approach around wellness, your well-being, physical well-being, and your mind.
Yeah, and I think that there's so much that you have just covered in that statement that is so relevant to obviously every single person who may be listening to this, right? In addition to that, there's so much there that I'm looking forward to unpacking with you from a sleep perspective, because there's such a huge intersection between the two. Now, when we're looking at the medical home, the primary care setting, this becomes even more critical as we age, because of the fact that we become higher likelihood for a lot of medical complexity, as well as decreased mobility. So you've described that we're able to provide this individualized, personalized care, which really is almost like the hallmark of what we do at Geisinger, right? We really look at every single person as that individual person, rather as a disease state or another person on a panel. It really is looking at, this is John, this is Jenny, this is Joseph, and really understanding who they are, what their personal goals are, and then partnering with them in order to achieve those. So 65 Forward is uniquely structured, however, to actually make that a reality. There's lots of healthcare systems who say that they do that, but they don't necessarily execute on it. So tell me a little bit, how is 65 Forward able to do this, and why is it so distinct from other primary care settings?
I love being able to answer this question. I love referring to 65 Forward as a true medical home where people should be coming to get all needs addressed, not just medical needs. So what we've done that's unique for us in 65 Forward at Geisinger is that we've created a physician-only practice with much smaller panels, so you get directed personal attention from your doctor. We've been able to provide good continuity. One of the things I hear very consistently in primary care is that you just get who you get because it's busy and there's a lot of lives to cover in traditional primary care. In 65 Forward, we're trying to change that. We want you to come in and see your doctor, your same team every time. And what I've found with that is that we get better responses. We actually are able to uncover more concerns from our patients because of that continuity of care. It takes a while to establish trust.
100%.
To be able to say to your doctor, I can't sleep at night, or this is bothering me. And so with the frequency that we can see our patients, we are allowing time to develop trust so that people can come in and not only say to us, this is what's bothering me, but this is what's working. This is what's going well. And let me share that with other seniors and other older adults so that it becomes a best practice for us.
Yeah. What's interesting is some of the things that you've stated. I think many of the people who may follow me or listen to some of the lectures that I've given is that I really want healthcare to move away from the HCP mentality of thinking that it's a healthcare professional, a healthcare physician. And I think we should be replacing that term with it's a healthcare partner, because you really are living the true experience of partnering with your patients to optimize that journey. So now you've opened a can of worms for me because you've also described that you've created a situation where people can endorse sleep issues. We recognize that in the United States, sleep issues is an epidemic. 1 out of 5 adults is what it used to be, estimated to be in about 2014 when the CDC initially declared that sleep is an epidemic, a public health crisis. We now are seeing those numbers get even worse, where it's about 1 in 3 to 4 children and adults experiencing sleep disorders. Unfortunately, as we age, we also become more susceptible to that. Not only because neurologically, we have the aging brain that may make us more prone to that, but then as we're introducing these medical complexities, as well as decreased mobility, it may make it harder for us to get that best night's sleep. How common is that as a complaint that you guys are hearing?
Well, interesting you should ask. I would say that when I see my patients and I'm doing my review of systems, one of the areas I ask is, how are you sleeping at night? And I hear more often than not, I can't sleep, or I can't stay asleep, or I'm struggling to get to sleep. And I think traditionally in primary care, one of the areas that we've looked at is we've done education around sleep hygiene, but then we get to this point, right? And we make these diagnoses of insomnia when really we're talking about sleep disturbance. And so we need help in understanding how to get our patients to get good night's sleeps. We know that when we have restless nights, our patients are more susceptible to falls, which creates a tremendous amount of uncertainty, but certainly can cause a cascade in medical conditions. So this is an area for us. We want to hear more, and we'd love to know how to do this better in primary care.
So that is music to my ears, because many people know that any opportunity I have is really trying to get other physicians and other healthcare people to think about sleep as something that is a tool for their practice. And so one of the things, again, that I'm very privileged to be a part of here at Geisinger is we've developed first in the community a program called Wake Up and Learn, which was a school-based program for our students in middle school and high school. And we've done this in adult learners. We've even done it with faculty. With that, we've had the privilege of being able to create a parallel model called Sleep to Be Well. And that's right. It was intentionally named Sleep to Be Well because it is a tool to make sure you're achieving your optimal wellness. With that, we're partnering with a lot of the different clinical programs in order to get at that exact need. We recognize there's only so many minutes in a visit, and trying to have a variety of different professionals learn a complete different history and management is really unrealistic. So we've created a command center approach where we're able to asynchronously meet with our patients, be able to help them identify what kind of sleep problems and get them on a track to their best night's sleep. So these are some things that I'm looking forward to being able to partner with 65 Forward in order to help you guys achieve your best days for all of your patients. So with that stated, there's going to be a ton more information where we're going to be breaking down what are some of the key susceptibilities that patients who may be 65 and older experiencing, and how does sleep play a role in it. Make sure you're looking for some of this other content, especially if it's relevant to you or one of your loved ones.